Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Living with Crohn's disease is an immense physical and emotional challenge. The severe abdominal pain, unpredictable flares, and sudden appetite collapse don't follow a schedule. Today, we're talking about how Crohn's fits into Pennsylvania's medical marijuana program.
It's a highly relevant topic for our community at PennsylvaniaMarijuanaCards.com. Crohn's disease was actually included as an explicitly named qualifying condition right from day one of PA's Act 16. What's unique here is that Crohn's is also covered under the broader inflammatory bowel disease category, meaning it's one of the few conditions on the state list protected under two distinct pathways.
That dual protection is fantastic, and the science behind why cannabis interacts with the gut is fascinating. There is a very specific disease-related disruption in the endocannabinoid system for Crohn's patients, correct?
Absolutely. A milestone study in mucosal immunology and recent 2024 data show that Crohn's patients have measurably lower levels of natural endocannabinoids in their inflamed gut tissue. The body's built-in system to regulate pain, motility, and inflammation is essentially running on empty. Introducing plant-based cannabinoids like THC and CBD targets those exact depleted receptors.
Now, your guide features an incredibly honest reality check that every single IBD patient needs to understand before starting. It's the difference between clinical response and endoscopic response. What does that mean practically?
This is the most critical takeaway. Multiple randomized controlled trials, including the landmark 2021 Naftali study, show that cannabis consistently improves how Crohn's patients feel. It reduces abdominal pain, cramps, and bowel frequency. However, it does not reliably reduce the underlying intestinal inflammation on a camera or blood test. Wow, so a patient can feel completely fine and symptom-free, but the actual disease process in the bowel wall could still be active? Exactly. That is why cannabis must be treated strictly as a symptom management adjunct, never as a replacement for your core biologic or immunomodulator therapies. Your gastroenterologist still needs to track mucosal healing objectively. Cannabis makes an exceptional partner to conventional medicine, but it shouldn't fly solo.
That is vital medical context. Let's break down the individual symptoms where the data is strongest. Abdominal pain and bowel frequency seem to top the list.
Yes, those are the most robust findings. THC directly slows down hyperactive gut motility, which reduces urgent stool frequency, while calming visceral pain signaling in the enteric nervous system. For nausea and appetite collapse, low-dose THC-dominant tinctures taken 30 minutes before a meal are highly effective simulators, addressing both issues at once.
Your guide also notes a couple of drug interactions that patients taking standard immunomodulators or methotrexate should be aware of.
Correct. High doses of CBD can inhibit the liver enzymes that process medications like methotrexate, potentially elevating drug levels in your system. It's not a hard contraindication, but it means you must bring your full medication list to your evaluation so our medical team can review it safely. Perfect. So if a patient with a confirmed Crohn's or IBD diagnosis wants to safely secure their card through your telehealth platform, what are the steps? We keep it completely seamless and stress-free. Step 1 is filling out our 3-minute online intake form at PennsylvaniaMarijuanaCards.com. Step 2 is your telehealth evaluation. You'll consult directly with a licensed state-registered physician, like Dr. Jonathan Chance Miller, whose official NPI credentials are fully verifiable right on our website.
Love that transparency. And what happens if the doctor reviews their records and honestly concludes that cannabis isn't a safe fit for their current GI treatment plan?
Then there is absolutely zero financial risk. If our physicians find that you don't meet the criteria or that it isn't safe for your current regimen, your $159 fee is fully and instantly refunded. If you are approved, Step 3 is automatic. We submit your state certification the exact same day so you can order your physical card. Patient first, risk-free, and highly educational. A wonderful resource for the IBD community. Absolutely. Don't struggle through flares alone. Head over to PennsylvaniaMarijuanaCards.com. Fill out the quick form at the top of our page and let our compassionate medical team guide you through every step. Book your telehealth visit today at PennsylvaniaMarijuanaCards.com. Thank you for listening and take care.